you will have regular periods to begin with, and suddenly since past 6-8 months your periods will be irregular. Let us first concentrate on exercise. So exercise, like we were talking about cortisol, corticosteroid hormone is high when you just wake up, because it's like a kickstart of your day. So if you have taken up an exercise regime or a fitness pattern, the severity of which is too high than what your body can actually manage. So if you are exercising too much, it is going to alter your corticosteroid levels. And the corticosteroid is like the kickstarter of your day, and that is then in turn going to affect somewhere your thyroid levels and the metabolism of your body. And all these things will collectively then affect the reproductive hypothalamo adrenal ovarian axis. And once that hormonal axis gets disturbed, temporarily your periods will be irregular. So if in the recent past you have started an exercise regime or a fitness regime which is very, very intense that you have not done before, and along the same time in 2-3 months there is absolutely no other change in any other area of your life but this exercise oriented change, then the cause of your irregular periods could be the exercise. We can dial down the intensity of the exercise. Maybe you can shift to a more less intense exercise, or maybe yoga, stretching, maybe Zumba or aerobics. And then we will see how is the change in your body. So if the level of exercise that you're opting for, you're doing it for a healthier and a fit body. If it's going to make you more unfit and more unhealthy, you should understand that it's time to change. Because one fitness regime has worked. So nowadays these fitness regimes are all a word of mouth, and they're all over the internet. If something works for someone, they put it out on the internet that this worked for me and I lost 10 kgs and I lost. If somebody is 80 kgs to begin with, the BMI is 30 and that person is losing 10 kgs, the person is becoming more fitter. But if somebody is 55 kgs to begin with and the BMI is 22 and you are losing 10 kgs, with the same regime that that person followed, you are becoming unfit. So you have to take these things with a pinch of salt, and you have to understand what is going to work for your body. If it is very confusing, you can have an actual trainer who will walk you through what's good, what's bad, or you can just consult your doctor to tell you that. So exercise most commonly seen as it's a very high intensity exercise which is not suiting your body, and because your body is trying to cope up with it and it's not able to, your periods become irregular, and mainly by disturbance of your hormonal axis, hypothalamo pituitary adrenal hormonal axis. With eating disorders, I would first like to address bulimia nervosa and binge eating disorders. With bulimia nervosa and binge eating disorders, because there is such a high volume of food intake in such a short span of time, the sugar level spikes in the body are too high then too low. So you are maybe eating, for example, a very common example, you have binged on, or you have right now eaten maybe 4 or 5 packets of your favorite chips. And now you're very scared that, oh, but my weight's going to increase, and you puke or you purge all that out. And then you're not eating anything for another 24 hours. So there was a very sharp rise in your blood sugar level, and that also caused a sharp rise in the insulin level. And now you're fasting. You just put all that food out of your tummy immediately, and now you're fasting. So there is a sharp drop in the sugar level and a sharp drop in the insulin level. And if your body is not going to get energy, your body is going to try and conserve energy for itself. Your body is wired that way. So this is where in this sharp rise and fall is where the insulin resistance pattern develops. And once the insulin resistance pattern develops, then insulin resistance, of course, like I mentioned earlier, it causes increase in the testosterone level. It also disturbs your hormonal axis. And that is how bulimia nervosa and binge eating disorders are going to cause period problems. Coming to anorexia nervosa is where it is fixated in a girl's or a woman's mind that even if she eats a little portion of food, she is going to put on weight. And it is at a more psychological level than at a physical level. The physical appearance of a woman, how it affects her psychologically, is the main root cause of anorexia nervosa. So in anorexia nervosa, because of deficiency of nutrition and major energy deficiency, there are no periods. Anorexia nervosa, usually you will not see irregular periods, you will just see amenorrhea. You were getting periods, you were getting periods, you were getting periods, and the moment you crash your diet, you stop eating anything at all, and you've lost 10-12 kgs because you are, hardly eating even 100 calories a day, or 500, 200, 250 calories a day. Your hypothalamus pituitary axis goes into a spin, and your periods stop then and there. So this was about eating disorders.
Yeah. So I think I have one follow-up question to this though. So whatever changes happen to our HPO axis, hypothalamus-pituitary ovarian axis, due to eating disorders or due to exercise, will these patients, or have you in your experience observed that these patients get back, like once they make the diet and lifestyle changes, do they get back to having regular cycles, or is there some permanent damage done?
The permanent damage, of course, has to be over the years. If you're following this kind of pattern for a period of 5 years, 8 years, 10 years, then there is permanent damage. And more than the permanent damage to the ovaries, there is more damage. There are brittle bones, brittle teeth, brittle bones, brittle teeth, brittle hair. There is no energy. Your skin is, obviously, there's so much deficiency of micronutrients that now, even if you start eating healthy, the absorption of the nutrients in the intestine is not going to happen. You can have megaloblastic anemia because of B12 deficiency, or anemia, iron deficiency anemia. There could be other vitamin related skin problems, hypopigmentation, or dermatitis. So these are the problems that start surfacing over a long term of period, and over a long term of duration of eating disorders. And as far as periods are concerned, once you start gaining your calories back, and once you start gaining a good amount of weight back, the periods will get regular. But then, of course, if the insult to your body is over a very long time, and if your HPO axis has shut down in very small percentage cases, it has also been seen that you are not able to revive it back. There is something known as primary ovarian failure, which I was going to talk about at the end, because it is seen in very less number of patients. So most commonly associated ovarian problem with such kind of eating disorders, women, is primary ovarian failure. Your ovaries go into failure, so your body is trying, your ovarian function is at a decline. So over a very long period of time, if primary ovarian failure has set in, it is very difficult. It is almost impossible to kickstart it again. But if it's just a period problem associated with the energy levels, the insulin resistance, and the weight gain in your body, the moment we correct these three basic pathologies, your periods will get back to regular. But there'll be a very different set of problems that you will be dealing with.